The Ministry of Health has assured the nation that the country is not facing yet another drugs crisis in health facilities. When speaking to our reporter Sibusiso Ngubane, Chief Pharmacist Fortunate Bembe said the report is far from the truth.
Following a report that was published in one of the country's newspapers implying that the country might be faced with another drugs crisis in health facilities, the Ministry of Health has allayed the nation's fears that there is no drugs and medicine shortages in the country. Chief Pharmacist Fortunate Bembe, in an interview with Swazi TV, assured the nation that there is no drug and medication crisis in the country, save for a few lines of medicine that are out of stock but can be used interchangeably with other medication that is available in stock.
What is currently prevailing in the country is not a crisis. We are by far not where we were in the beginning of this current year, 2017. A lot has improved on the ground since the implementation of the Prince Sigelela report. We have paid our suppliers and they've delivered their medication. It's true that one or two medication might be out of stock, but that does not amount to a crisis. In some of the cases, some of the medicines that are currently out of stock are interchangeable with other medicines within the same class. So we do have most of our pain management medicines, most of our antihypertensive medicines. It's true that hydrochlorothiazide is currently out of stock and we are following it through, but the rest of the other lines are currently in stock. And anti-diabetic medicines, we have them in stock. Anti-epileptic medicines, we have them in stock, including the programmatic medicines like antiretrovirals, anti-tuberculosis, and sexual reproductive health commodities. So a lot has improved on the ground. It's true, we do know that there are fears on the ground when you see one or two out of stock and then people start panicking. But we would encourage the nation not to panic, because the ministry has their best interests at heart and we're working around the clock to make sure that we avail medicines that they need to the public.
Bembe says as His Majesty's government mandated them to implement the Prince Sigelela report, they've already started implementing new drugs management systems.
Is that we have now a bigger warehousing facility for our medicines at Central Medical Stores. So we had to relocate from the old Central Medical Stores into the newer facility. And together with that, we are changing our inventory management system into a new warehouse management system that will ensure better traceability and accountability of the medicines. Yes, as of now, the system is still largely centrally based at Central Medical Stores, but as of the 1st of October, we will pilot with one facility, which will be Peak Health Facility, so that we link them to the Central Medical Stores and see how best it works. Once we have seen that it's working, then in the following year, 2018, we will link the facility in the initial phase with all the hospitals, and then we'll move into health facilities and lastly the clinics. This is in a bid to improve the stock status situation as proposed in the Prince Sigelela report.
Asked where the report that was published came from, the chief pharmacist said they have no idea because they called the facilities that were cited in the report and only discovered that they had not received their monthly stock, which is still being prepared, and they advised them to order emergency stock. Reporting for Swazi TV News, I'm Sibusiso Ngubane with Ernest Mabaso, Mbabane.